It was 11 at night when my phone buzzed on the nightstand. I almost did not answer it. The caller ID said Vivian Okafor, and I knew Vivian. 71 years old. Retired head librarian from the Savannah Public Library System. The kind of woman who alphabetized her spice rack and ironed her pillowcases. She had been my patient for 6 years, and in all that time she had never once called me after hours. When I picked up, she said, "Dr. Hale, something is wrong with me, and I do not know what it is. My knees hurt so badly I cannot walk down my own stairs. My brain feels like it is filled with cotton. I forgot my granddaughter's name yesterday. My granddaughter. I have known that child since the day she was born. And my doctor says my blood work is normal." I asked her 3 questions. When did the joint pain start? When did the brain fog begin? And had anything changed in her daily routine in the last 3 to 6 months? She told me the joint pain started about 5 months ago, first in her knees, then her wrists, then her shoulders. The brain fog came a few weeks later, forgetting words, losing her train of thought mid-sentence, walking into a room and standing there with no idea why she came in. And the change in her routine was this. After a fall 8 months ago, she had started taking ibuprofen every single day, sometimes twice a day. Her orthopedist told her it was fine for the inflammation. Nobody told her what that pill was doing to the lining of her gut. I am Dr. Margaret Hale, 28 years in integrative medicine and clinical nutrition. And today I am going to show you what happens when your intestinal lining develops microscopic holes and starts leaking bacterial toxins directly into your bloodstream. It is connected to joint pain, brain fog, and chronic inflammation in ways that most doctors never explain. Your gut lining is 1 cell thick. Let that sink in for a moment. The barrier between the inside of your intestines and your bloodstream is a single layer of cells. These cells are called epithelial cells, and they are packed together side by side like bricks in a wall. But unlike a brick wall, your gut does not use mortar. It uses something called tight junctions. Tight junctions are protein structures that form a seal between each cell. They act like the corking between tiles in a shower. When the corking is intact, water stays where it belongs. When the corking cracks, water gets behind the wall and causes damage you cannot see until it is too late. Now here is where it gets critical. Your gut contains roughly 38 trillion bacteria. That is more bacterial cells than human cells in your entire body. Most of those bacteria are beneficial. They help you digest food. They produce vitamins. They regulate your immune system. But some of those bacteria have a molecule on their outer surface called lipopolysaccharide, or LPS. LPS is essentially a bacterial toxin. In a healthy gut, LPS stays inside the intestine where it belongs. The tight junctions keep it locked in. But the moment those junctions open, the moment that caulking cracks, LPS escapes into your bloodstream. And that is when everything starts to go wrong. Think of it like a prison. The walls are intact. The guards are in position. The inmates are contained. But if someone opens the gates, every single prisoner floods into the streets and chaos spreads through the entire city. That is exactly what happens when LPS crosses your gut barrier. It does not stay in one place. It travels everywhere your blood goes. Your joints, your brain, your liver, your heart. And everywhere it lands, it triggers the same response: inflammation. Researchers at Massachusetts General Hospital, led by Dr. Alessio Fasano, discovered the exact molecule that controls whether your tight junctions stay sealed or open. It is called zonulin. Zonulin is the only protein identified in humans that reversibly regulates the opening and closing of tight junctions. When zonulin levels are low, your gut barrier stays tight. When zonulin levels rise, the junctions open and permeability increases. Fasano's research showed that two things reliably trigger zonulin release. The first is a protein found in wheat called gliadin. Even in people without celiac disease, gliadin causes a transient release of zonulin and a temporary increase in gut permeability. The second trigger is bacterial overgrowth. When harmful bacteria come into contact with your gut lining, zonulin is released. And in people with chronic dysbiosis, that release becomes constant. The gates never fully close. But here is what I see in my clinic that most gastroenterologists overlook. There is a third trigger, and it is sitting in medicine cabinets across America right now. Non-steroidal anti-inflammatory drugs, NSAIDs, ibuprofen, naproxen, aspirin taken daily. These medications directly damage the epithelial cells and disrupt the tight junction proteins. A clinical trial at the University of London tested this directly. They gave 10 healthy volunteers the NSAID indomethacin at standard clinical doses for 5 days. Gut permeability tripled. A threefold increase in intestinal leakage in just 5 days in people who had perfectly healthy guts before the study started. That was Vivian. 8 months of daily ibuprofen, not because she was sick, because she fell and her knee hurt and her doctor told her it was fine. Now, if you know someone right now who takes ibuprofen or naproxen every day for joint pain or headaches or back pain, please send them this information right now. They need to understand what is happening inside their gut before more damage accumulates. Let me show you what happens after LPS crosses your gut barrier, because this is where the joint pain and the brain fog come from. When LPS enters your bloodstream, your immune system treats it as a full-scale invasion. It activates a receptor on your immune cells called toll-like receptor 4, or TLR4. This receptor is essentially an alarm system. The moment it detects LPS, it triggers a cascade of inflammatory molecules. Tumor necrosis factor alpha, interleukin-1 beta, interleukin-6. These are the same inflammatory molecules that drive rheumatoid arthritis, lupus, and dozens of other autoimmune conditions. And they do not stay in one place. When these inflammatory molecules reach your joints, they activate the immune cells in your synovial tissue. That is the tissue that lines and cushions your joints. The result is swelling, stiffness, and pain that feels exactly like arthritis, but does not show up as arthritis on standard blood work. Vivian's doctor ran a rheumatoid factor test and an ANA panel. Both came back normal. Because the inflammation was not coming from an autoimmune antibody, it was coming from her gut. And then there is the brain. Researchers published findings showing that LPS induced neuroinflammation and cognitive impairment through activation of microglial cells in the brain. These are the immune cells of your central nervous system. Once activated by LPS, microglia release the same inflammatory molecules inside your brain tissue. A study published in PLOS1 found that a single exposure to LPS caused elevated levels of TNF-alpha and IL-1 beta in the hippocampus that persisted for up to 30 days. 30 days of brain inflammation from one exposure. Now imagine what happens with chronic daily leakage from a damaged gut. The hippocampus is your memory center. Vivian was not developing dementia. She was developing neuroinflammation from a leaking gut. And once we sealed her gut lining, her memory started coming back. Think of it like a fire alarm system in a building. Normally, the alarms are silent. Everything is calm. Every floor is quiet. But if someone pulls one alarm in the basement, the signal does not stay in the basement. Every alarm on every floor starts ringing. Every sprinkler activates. The entire building goes into emergency mode, even though the fire is only in one room. That is what LPS does to your body. One breach in the gut, and the alarm sounds in every organ system. Your joints swell. Your brain slows down. Your liver works overtime trying to clear the toxins. And the entire time, the source of the fire is aligning one cell, thick in your small intestine. For those of you who want my complete step-by-step protocol for repairing your gut lining and rebuilding every other system in your body, I created the Cellular Reset. It is my comprehensive guide with exact doses, timing, and food combinations. The link is in the pinned comment below this video. Now let me give you the exact protocol I used with Vivian and that I use with every patient who shows signs of increased intestinal permeability. Step 1. L-glutamine. This is the most important amino acid for your gut lining. Your epithelial cells use glutamine as their primary fuel source, not glucose, not fatty acids. Glutamine. When glutamine levels drop, your gut cells literally run out of energy and the tight junctions weaken. A randomized placebo-controlled trial studied patients with increased intestinal permeability and gave them 5 grams of glutamine 3 times daily for 8 weeks. The results were remarkable. 79.6% of patients in the glutamine group achieved normalized intestinal permeability. The placebo group showed 5.8%. That is not a subtle difference. That is a 74% gap between the treatment group and placebo. The dose I use in clinical practice is 5 grams dissolved in water, taken on an empty stomach 3 times per day. First thing in the morning, mid-afternoon, and before bed. Step 2. Zinc carnosine. This compound does something that glutamine alone cannot do. It physically adheres to the damaged areas of your gut lining and stimulates repair at those specific sites. Think of glutamine as the fuel that gives your gut cells energy to rebuild. Zinc carnosine is the construction crew that shows up at the exact spot where the wall is broken. The same clinical trial I mentioned from the University of London tested zinc carnosine alongside the NSAID indomethacin. When volunteers took 37.5 milligrams of zinc carnosine twice daily, the threefold rise in gut permeability caused by the NSAID was completely prevented. The gut stayed sealed. The dose I recommend is 37.5 milligrams, twice daily taken with meals. Step 3. Collagen peptides or bone broth. Your gut lining is rich in collagen, particularly types 1 and 3. Providing the raw materials for collagen synthesis gives your body what it needs to physically reconstruct the epithelial barrier. Bone broth made from long-simmered bones contains glycine proline and hydroxyproline, which are the 3 amino acids your body uses to build collagen. If you do not have time to make bone broth, a high-quality collagen peptide supplement at 10 to 15 grams per day dissolved in warm liquid provides the same building blocks. Step 4. Remove the triggers. This is where most people fail because they want to add supplements without removing what caused the damage in the first place. If you are taking daily NSAIDs, talk to your doctor about alternatives. If you consume alcohol, regularly reduce or eliminate it for at least 30 days. Processed foods containing emulsifiers like polysorbate 80 and carboxymethyl cellulose have been shown in research to directly disrupt the mucus layer that protects your gut lining. For 30 days, eliminate processed foods with long ingredient lists. Eat whole foods. Cook at home. Give your gut a chance to close the gates. Step 5. A targeted probiotic. But not just any probiotic. Look for strains that have been specifically studied for barrier function. Lactobacillus rhamnosus, GG, and Bifidobacterium longum are 2 strains with clinical evidence for improving tight junction integrity. Take them after you have started the glutamine and zinc carnosine, not before. Your gut lining needs to be partially repaired before you introduce new bacteria, or you are just adding residents to a house with no walls. If you are subscribed to this channel, you know I release new research every other day. If you are not subscribed yet, make sure you hit that button now, because next time I am going to reveal the breakfast food that 90% of people over 60 eat every single morning that is actively feeding cancer cells in your body. Now let me tell you, the 3 mistakes that keep most people from ever healing their gut. Mistake number 1. Taking probiotics without repairing the lining first. This is the most common mistake I see. Someone reads that probiotics are good for gut health, so they buy the most expensive bottle on the shelf and start taking them. But if your tight junctions are open and your barrier is compromised, adding more bacteria to a leaking system does not fix the leak. It is like adding water to a bucket with holes in the bottom. Fix the bucket first. Glutamine and zinc carnosine for at least 3 to 4 weeks before introducing probiotics. Mistake number 2. Continuing to take the triggers. I cannot tell you how many patients come to me taking glutamine supplements every morning and then taking ibuprofen every afternoon. You cannot outpace destruction with repair if the destruction is happening daily. The trigger has to be addressed. Whether it is daily NSAIDs, excessive alcohol, processed food additives, or chronic stress. You have to reduce the assault on your gut lining while you are trying to rebuild it. Mistake number 3. Believing the damage is permanent. This is the most dangerous mistake because it leads to resignation. Your gut lining replaces itself every 3 to 5 days. That is one of the fastest cell turnover rates in your entire body. This means that with the right fuel, the right building materials, and the removal of the triggers, your gut has the biological capacity to seal itself in weeks, not years. The clinical trial showed measurable improvement in permeability in 8 weeks. 8 weeks? The damage is not permanent, but the repair requires consistency and commitment. Drop a comment below and tell me. Are you taking NSAIDs daily? Have you noticed joint pain or brain fog that your doctor cannot explain? I read every single comment, and I want to know your experience. Let me tell you what happened with Vivian. After her late-night phone call, I saw her the following Monday. I ran a zonulin test. Her levels were significantly elevated. I started her on the full protocol. 5 grams of glutamine 3 times daily. Zinc carnosine twice daily. Collagen peptides in her morning tea. And I worked with her orthopedist to transition her off daily ibuprofen and onto a topical alternative for her knee. At 2 weeks, she told me the brain fog was starting to lift. She said it was like someone had been slowly turning up the lights in a dark room. At 4 weeks, her knee pain had not changed much, but her wrist and shoulder pain had decreased noticeably. Those joints had been inflamed by LPS, not by structural damage. At 8 weeks, I ran a follow-up zonulin test. Her levels had dropped by 41%. Still above normal, but moving in the right direction. Her brain fog was almost completely gone. She told me she hosted her book club for the first time in months and remembered every title they discussed without writing anything down. At 10 weeks, her orthopedist told her he was genuinely surprised. The knee still had some structural wear from the fall, but the generalized joint inflammation had resolved almost entirely. Her wrists no longer ached in the morning. Her shoulders moved freely for the first time in months. At 12 weeks, she called me again, this time during business hours. She said, "Dr. Hale, I want to volunteer at the library again." I told her I thought that was a wonderful idea. She said, "No, you do not understand." I stopped going because I could not remember where the books belonged. I could not remember the Dewey Decimal System, a system I used every single day for 34 years. And now it is coming back. That is what a leaking gut does. It does not just make your stomach hurt. It sends inflammatory molecules into your joints and makes you think you have arthritis. It sends them into your brain and makes you think you are losing your mind. And the entire time, the answer is not in a prescription pad. It is in the lining of your intestine, 1 cell thick, held together by protein seals that can be broken by common everyday medications and rebuilt by amino acids that cost less than a cup of coffee. So you have 4 things working together when you follow this protocol. Glutamine fuels the epithelial cells so they can regenerate. Zinc carnosine physically repairs the damaged sites. Collagen provides the structural building blocks. And trigger removal stops the ongoing destruction. 4 elements: a gut lining that replaces itself every 3 to 5 days, and clinical evidence showing measurable improvement in 8 weeks. If this information opened your eyes to something you did not know about your gut, please share this with someone who needs it. Your friend who takes ibuprofen every day. Your parent who complains about brain fog. Your neighbor whose joints ache and nobody can figure out why. This information could change their next year. And if you want the complete gut repair protocol with every dose, every timing, and the exact foods that accelerate healing, it is all inside the Cellular Reset. Link in the pinned comment. Next time, I am going to show you the breakfast food that most people over 60 eat every single morning, thinking it is healthy when research shows it is actively feeding cancer cells and spiking inflammation. You do not want to miss that one. Make sure you are subscribed. Your gut is talking to you. The joint pain is a message. The brain fog is a message. Start listening. Dr. Margaret Hale.